41-year-old male, 6 years of refractory focal with impaired awareness, no motor, onset seizures. Neuroexamination normal. This is the our patient's MRI. It shows apparently a lesion located in the left frontal horn. But if we pay close attention, we can see that the pericallosal artery is involved by the tumor. So see, here is the pericallosal artery, and here's it goes lower than the floor of the frontal horn. This is a coronal cut, yet apparently is a tumor that originates in the subcallosal area and grows upwards, pushing the floor of the left frontal horn upwards, and also involves the pericallosal arteries both anteriorly and posteriorly. I chose for this case left frontal craniotomy, interhemispheric transcallosal approach. This is the positioning of the patient. This is the exposure after the dural opening. Here we have the superior sagittal sinus, and here we have the falx, and the first step is to split the interhemispheric fissure, separating both frontal lobes. Now let's go to the video. So the careful dissection to separate the both cingulate gyri. This is the not pericallosal, this callosal marginal artery. So we continue now. I can see the pericallosal artery, and if I go downwards, that more dissection, we're going to expose both right and the left pericallosal arteries at the level of genu. This is corpus callosum. This very white, very easy to identify. This is I'm putting gel foam to serve as retractor, so I don't have to use spatula. The gel foam will keep the space open. This is the genu of the corpus callosum. If you want to go to region of foramen Monroe, you have to come back like a 2.5 and 3 centimeters behind the genu of the corpus callosum. But I want to go to the frontal horn, so I have to make the corpus callosotomy a little bit more anteriorly. So now the left frontal horn has been opened. I'm making room, working room. So this is cottonoid. Underneath the cottonoid, we have this. This is already a tumor, pushing the rostrum of the corpus callosum upwards. So now I'm already working on the tumor. You see this grayish tissue, which is tumor. Luckily, it is easy to distinguish. See, this is tumor, and this is corpus callosum. Now I'm getting samples for histology analysis. We know by looking at the preoperative MRI, at a certain point we're going to see pericallosal artery involved both anteriorly and posteriorly by the tumor. So here's the pericallosal artery. We have to be careful. And then continue to follow the tumor. Tumor is suckable. Luckily, it is suckable, and we are removing. This is all tumor. You can see it's very different from the normal, for instance, white tissue of the corpus callosum. Now, continue to remove it. This is normal tissue. This is not. This is tumor. This is almost normal. And this is tumor. It does not bleed so much, luckily. So this is almost normal. Hemostasis. Continue to remove anteriorly and inferiorly. Removing more. This is the final aspect of the tumor removal, and we have to remove those gel phones. So this is the final aspect of the surgery. This is the postoperative MRI showing the total removal of the tumor. You see the preservation of the pericallosal arteries. See, this is the left frontal horn. He had an uneventful postoperative course. He is seizure-free since the surgery performed in 2011, and the histology showed grade 2 oligodendroglioma.